Bismillahirrahmanirrahim. I start the CME with the name of Allah, who is very kind uh, and merciful. CME update by Mother and Child Survival Group of Pakistan. Me, Dr. Tariq Masood Khan, Obs Gynae Family Emergency Specialist Internist, Gulf KSA, presently working as gynecologist in a district setup. Topic for today is a 52-year woman taking tamoxifen for her breast cancer treatment, having hot flushes, wants to start HRT. How you counsel her? It's a very important subject. How to counsel her, advise her, and inform her, and to have an informed consent for starting the HRT for the hot flushes. Have to take a detailed brief history of the treatment, medical and other treatment history, sexual history, and gynecological history as well. All details should be kept together and be analyzed, and then her test to be done, which include TSH, FSH, LH, and LFTs, RFTs, CBC, and others. Routine basic tests for bone densiometry, which is very important for osteoporosis, and weight, obesity. So after dealing with this, you have to find out her lifestyle and her catering the and her lifestyle and her habits and her pastime. She is doing any weight bearing exercises, walk exercises, and avoiding stress, as it is a matter of great distress, lead to distress and disaster and depression, especially anxiety and depression. So she has to take a healthy lifestyle, healthy food, increase in water content, and vegetables and fruits, and also vitamin E, vitamin minerals and vitamins, and especially vitamin D, and intake and calcium and vitamin D, and increase in the calcium intake, milk intake. And then she should avoid smoking, alcohol, and some other things like black cohosh, so as to trigger flushing and other thing, spicy foods and cola drinks and other things she should avoid, and increase in the lifestyle, healthy lifestyle, which is very helpful at this very age. As she is a case of breast cancer and taking anti-estrogen, tamoxifen, and so she should be her oncologist to be discussed, her case to be discussed with her oncologist, and then we have a choice for starting HRT. Estrogen is the best one, and it is helpful in reducing the hot flushes. So estrogen HRT can be started. However, the estrogen progesterone, they are contraindicated in this type of case, because as of estrogen and progesterone breast receptor positive status may be. Then another, we can have progestogens. We can start progestogen, medroxyprogesterone, and the other one nortestosterone, and can increase the dose, and they are helpful in reducing this, but combination is not ideal for and is contraindicated for their use. Another thing is that Tibolon is a SERM, selective receptor modulator, SE, selective estrogen receptor modulator, is very ideal, is also very helpful in reducing the flushing, but it should not be used in combination with other. Though it helps, uh, and it can be, but there's a bit danger for the breast cancer. And then comes the other non-selective things, non-HRT, HRT and SERMs. There are other drugs which are used, and these are SSRI and non-SRI. They are helpful in reducing the increased anxiety and all these symptomatology, stress, and they decrease, but they also decrease the libido. So now we have the choice. Estrogens, they are helpful. Estrogen, progesterone, they are contraindicated. Progesterone we can use, and Tibolon, HRT, and then we can use these vitamin D and other thing, and calcium and other intake along with healthy weight lifestyle and reducing the weight. Then comes that we have to discuss all this thing with the multidisciplinary team, including the oncologist, the present state of her disease, and an approach and investigation, and all these things should be assessed together, and then it should be with the career program approach. A multidisciplinary approach is adopted to solve these issues, and then the supports group be added so that these patients can have their support groups among those who are basically having these breast cancer and taking this anti-cancer drugs with the HRT. And then you have to provide them with information leaflets, other information, support groups addresses, and in other society you have to involve their community nurse and the community GP, and all this together in a multidisciplinary team, just for the better assessment and better management of the patient. So a brief review on HRT on a patient of breast cancer taking Tamoxifen. So takeaway lesson is pray, praise, trust, love, follow, worship, talk Allah, and follow Asna Hazrat Muhammad sallallahu alaihi wasallam, our health and survival. And we should not forget our glorious past, which is दोनीम इनके ठोकर से सहरा और दरिया सिमट कर पहाड़ इनकी हैबत से राय, एंड हस्बुनल्लाह नेमुल वकील नेमुल मौला और नेमुल नसीर वकुफ़ा बिल्लाह वलिय वकुफ़ा बिल्लाह नसीरा. La ilaha illallah Muhammad Rasulullah. This is a kalma return, and we should always pray that whenever we leave the world, we should have the power and motivation to recite La ilaha illallah Muhammad Rasulullah. Thank you very much for another CV. Take care. Best of wishes and regards. Dr. TMK will come with another review. Wama alayna illal balagh.